Hi, welcome to Medicoria. In today's video we shall discuss the liver function tests, the components of the liver function tests and how to interpret them. Liver function tests consist of markers of liver damage and indicators of liver function. Interpretation of liver function tests should be correlated with the clinical picture for accurate diagnosis. One of the components of the liver function tests are the liver enzymes. For example, alanine transaminase and aspartate transaminase. These enzymes are contained in the liver hepatocytes and they take part in amino acid metabolism. So in the event of damage to liver hepatocytes, these enzymes are released into the plasma and their levels increase. We also have gamma glutamyl transferase and alkaline phosphatase. These two enzymes are produced by and are expressed on the surfaces of the cells lining the biliary tract. We shall talk about how to interpret the levels of this in a moment. Tests also include a measurement of the total level of proteins in serum. This may give an insight into the synthetic ability of the liver. We also measure the total level of bilirubin in serum. This measures the ability of the liver to eliminate bilirubin from blood and to secrete it in bile. We also measure prothrombin time. This measures the ability of the liver to produce the different clotting factors. There are other tests of liver function that are not routinely done in the liver function tests, but they are ordered in specific situations, and I will give a comment about this in the end of this video. Now let's dive in and talk about how to interpret this and how they vary in the different situations. Let's start with the changes that take place in the event of hepatocyte damage. Liver hepatocytes might be damaged in situations such as hepatitis or drug overdose. Usually, it is the level of ALT and AST that is increased. ALT is more specific to the liver, whereas AST is also expressed in other tissues like skeletal muscles and the cardiac myocytes. Therefore, an isolated increase in the level of AST without an accompanying increase in the level of ALT could point to damage to skeletal muscle or cardiac myocytes and not damage to hepatocytes. But an increase in the levels of both is more specific to hepatocyte damage. An acute damage to hepatocytes usually does not affect the level of proteins, especially albumin, because albumin has a long half-life of about 20 days. The level of bilirubin rises because of impaired conjugation of bilirubin by the hepatocytes. The prothrombin time may also increase because the clotting factors generally have a shorter half-life. In cholestasis, it is usually the level of GGT and ALP that is elevated. An isolated increase in the level of GGT could point to induction of the enzyme by alcoholism or by ingestion of certain medications like anticonvulsants, for example phenytoin. On the other hand, ALP is also produced by other tissues, especially bone and by the placenta during the third trimester of pregnancy. Therefore, an isolated increase in the level of ALP without an increase in the level of GGT could point to osteolysis or to pregnancy in the third trimester. An increment in the levels of both GGT and ALP is more specific to cholestasis. In cholestasis, the level of bilirubin is also increased because of impaired excretion of bilirubin in bile. Like already mentioned, in alcoholism, the level of GGT is increased without an accompanying increase in the level of ALP. We need to note, however, that in severe liver damage, there is usually an increase in the levels of all the four enzymes. Therefore, it may be difficult to tell whether the increment is due to hepatocyte damage or due to cholestasis. Now, how do you differentiate acute liver damage from chronic liver damage? In acute liver damage, like already mentioned, the level of proteins is likely to remain unaffected. However, in chronic liver damage, the level of proteins begins to fall. There are also other tests of liver function apart from the ones that are done routinely. For example, the levels of alpha-fetoprotein are important in hepatocellular carcinoma. Procollagen is an important marker of liver cirrhosis. The lipid profile could also be altered in cholestasis and other diseases of the liver. These are just some, but not all, of the other tests that could be important in the assessment of liver integrity and liver function. Thank you for watching. Don't forget to like and to subscribe to the channel. See you in the next video.